Hi, Dave here for Family Wellness Acupuncture, and we get a lot of questions about like what it's like to get acupuncture. So I thought I'd go in today, talk to Ryoko, and ask her a few questions about that, and kind of hear it from her as to how the process typically goes. All right, what do you say we go inside? So you welcome me into the room, and what happens after I get into the room?
What happened?
Yeah, what's a typical, like, so if a new patient's coming in, you bring them back into the room and you tell them, hey, sit down for a minute, let's talk. Okay, so what's happening here?
I'm asking how may I help those people? How could I help people? How could I help this person?
Are you asking yourself or are you asking the person?
The person.
So you're asking questions to figure out what they need help with.
Right.
Okay. Like what would be a question you'd ask me if I said, hey, I'm here for back pain?
Nobody said back pain. Nobody say what's wrong with them. They're just sitting, waiting.
Oh, okay.
Me ask whatever.
So you have to ask okay, what did you come to see me for today?
How could I help you?
How can I help you? And then I would say, well, my back hurts.
Why?
Right.
Is there any reason? How long have you been suffering from?
Right. You're going to ask about that to understand it. Okay. So now that you understand my problem, what happens next? What are we supposed to do? Do I get changed? Do I get on the table?
Lay down here first.
Do I need to get changed?
No, you don't. First.
So I lay down on the table, and then what happens?
His back pain. I need to check some kind of a test for lower back pain. Then finding out what is going on, what's wrong with the lower back. Then after that, take pause and change the clothes. Lay down your stomach.
So I don't just get needled right away. You're trying to make sure you know where I need the help. Okay. And then what? You start, once you figured that out, you start needling?
No.
Okay.
You need to change.
Oh, then I change.
Then lay down your stomach.
Okay. Is it like I just lift up, like in my case, is it just lift up my shirt, or do I take my shirt off, or do I need a patient gown?
Possible patient gown is easier for me, but not that many people want to wear. If it's a guy.
I know I don't. Okay. All right. And then I'm now ready. I think I'm ready. Is that when you start needling? Okay. So you're gonna put in the needles, and then what exactly is happening there, or what goes on after that? Well, you put the needles in, then what, basically?
I'm going to keep those needles for 15 minutes or so.
15 minutes? What am I doing during those 15 minutes?
Just relax it, lay down.
Are you with me?
No.
So you leave the room? You don't need to stay. You can just make sure my treatment's set up, I'm getting the care that I need, and then to help me relax, you leave the room so that I can be comfortable and let the treatment do its work. Kind of like how Western doctors will say, hey, take this, wait 30 minutes, it needs time to work. So that's exactly what's happening here, right? The needles need time to do their work, to help like whatever it is they do. Okay, so after 15 minutes, you're gonna come back in the room?
Yes.
And then what?
Then flip forward, start doing front side treatment.
So another treatment? Okay, so there might be more than one needling session?
It'll be 15 minutes front side treatment.
I see. So it depends on what I need help with that.
No, really. That's my way to do.
I see. And that improves the ability for me to heal better, for a better outcome?
I think so. I believe so.
You've seen this help people before. That's why you do that. Okay, so it does provide a better result, is what you're saying.
Mm-hmm.
Okay. So now that I've gone through however much treatment is necessary for me to start getting better,
Mm-hmm.
what do? Are the needles still in me, or am I?
For 15 minutes, yes. Then after the 15 minutes, take everything out
Right.
to see how the pain level is. And if it's not good, probably this person need more treatment.
Okay.
Mm-hmm.
So then,
It's depending on how chronic it is. If it's chronic, way more than probably 5 treatment required.
so like with my back pain, as you know, I've had to come back multiple times, but not always. Like I've had periods where I've hurt my back and I had to come back 10 or 12 times in 1 to 2 months to get better. Sometimes I only need 1, 2, or 3 treatments and I'm good to go. And sometimes I go like a year or 2 with nothing and then I need to come back. Right? So this is kind of what you mean with like a chronic or a recurring kind of. Right. So would you?
But regular acupuncture helps not to have back treatment.
Right. So
once a month, every 3 months,
So even if I don't need the help, I should be asking for some help just so I don't need the help. Preventative care.
Acupuncture is
Right.
really preventive.
Right. So that's a good way of putting it. It's like, hey, come back once a month or so, and then
maintain that you are.
Maintain. Okay. After all that, when do you? So now that you've done all that, you take the needles out at this point, and then what happens?
Then change the clothes and go to front desk
And check out.
To check out.
And probably book another appointment either to get preventative care or because it needs more treatment to get better. So nothing's what we say one and done. It's maybe on a rare occasion that's good, but most of us just need several or more treatments to really get better, which is true for any doctor I've ever seen. Okay, so well that makes sense. And I'm gonna get a treatment. You're gonna help me with that, and we're gonna show what that's like. So it's not just us talking. Yeah, I'm not even sure. Okay, so this is the needle that you use. It's very small. It's very thin. It's got a red tip. I don't know if the camera is picking up. Yeah, I don't know if the camera is picking up the. I think the camera is picking up the needle point. It's very thin, so it's very hard to see it. However, are there different types of needles?
This is 0.16 millimeter.
So I don't know what that means, but is there like a thicker or a bigger one? Is this like a typical needle that you would use, or?
This is a 0.2 millimeter needle.
So it's a little bit bigger. Oh, I can see it, like just visually I can see it better. I don't know if the camera picks that up, but okay. And then are there other types of needles that people use? Like, is there a particular style or something?
Longer, maybe.
Like, are there really thick and hard needles, like the stuff people are really?
I don't have the big one. This is the biggest I have.
And that's still pretty thin from what I see.
0.2 millimeter.
Okay.
A little longer.
But there are bigger ones. Who uses bigger ones? Or thicker? Who?
Chinese practitioner.
So that's more of the Chinese style? And your style is Japanese? So Japanese needles are thinner.
Way thinner.
And easier to work with?
To me, yes.
Yeah. And provide good results?
I think so.
Okay. Wow. Well, that's very interesting. So I think what we're going to do is, as promised, I'm going to get a treatment. Hopefully I'm on camera. It's hard to see. Anyway, I'm going to get a treatment right here on this table, and we're going to show what that looks like so that it's not just us talking on camera. All right.